Good morning, and thank you, API Malwa, for inviting me for the virtual API State Conference of Malwa. I'm delighted to be a part of the meeting, and what I'll be doing is discussing on artificial sweeteners. So I'll be sharing my screen right now. Thank you very much. At the very outset, let me thank everyone for inviting me to be a part of this conference, especially Dr. Vitull Gupta, who has been following all the speakers from day one of the origin of the idea of the conference. We salute your dedication and perseverance, sir. Let us move on to the topic proper. Today I'll be talking on artificial sweeteners, sweet or sour, and what we'll do is I'll cover the topic as an introduction, then we'll be classifying the sweeteners, what constitutes an artificial sweeteners, where are these artificial sweeteners used in our daily day-to-day life, what are the advantages, what are the disadvantages. We'll discuss some important artificial sweeteners, and we'll leave the entire topic to the public at large to decide whether to use artificial sweeteners or not, because there are so many ifs and buts. So let us begin with the topic proper. We all know that sugar is a common component of our diet. In majority of our population, it becomes the most important component of our diet when we finish our one-time food. And it's also a major contributing factor to a number of health problems that includes obesity, increased dental diseases, especially in children and also in adults. Now we have obesity-related whole plethora of diseases like type 2 diabetes, cardiovascular diseases, hypertension, and we have seen the recent trends that it has not only involved the older individuals, but the trend has been increase in obesity and obesity related problems in young adults, especially in India, where all of these diseases come a generation earlier than their American and European counterparts. Probably sugar has some important role in the early causation. Now, knowing all these things, the industry, the manufacturing industry, the business manufacturers of these artificial sweeteners have taken this adversity as an opportunity to promote their products and have been marketing them as a safe product for all ages. Now it depends entirely on us to decide whether to use these artificial sweeteners or not, because there is a lack of conclusive evidence-based research to either encourage or discourage their use on a regular basis. So the audience has to decide whether to use or not to use. Sugars like fructose, dextrose, lactose, maltose, honey, and concentrated fruit juice are called nutritive sweeteners, and sugar alcohols including sorbitol, mannitol, xylitol, maltitol, and erythritol are also considered nutritive sweeteners. Now, nutritive sweeteners add calories to the diet, whereas non-nutritive sweeteners, which is the topic of interest for today, do not add energy. So let us classify the artificial sweeteners. So sweeteners, things which are sweet and palatable, can be divided into natural sweeteners and artificial sweeteners. Now, amongst the artificial sweeteners, we can have nutritive sweeteners and we can have non-nutritive sweeteners, which is called, which is the topic of discussion today. So nutritive sweeteners, as I just mentioned, are sugar alcohols, Well, non-nutritive sweeteners are aspartame, sucralose, and the rest, as we'll discuss. Artificial sweeteners are basically synthetic compounds. They are highly sweet, but they are non-nutritive. So they may be advantages and there may be disadvantages. So the examples of artificial sweeteners are S-sulfam K, aspartame, cyclamate, saccharin, sucralose, neotame, and stevia. Now the FDA has approved only 5 non-nutritive sweeteners which are mentioned in the red, and the others have not yet been approved by the FDA. So let us come on to the public health related issues. As the trend goes, consumption of artificial sweetener containing foods has drastically increased among people of all ages because of the increased awareness of obesity related issues, diseases. Thereby, we have seen almost 28% of the total population reporting their intake of artificial sweeteners. We all have come to know that artificial sweeteners are known to be at least 30 to 13,000 times sweeter in taste compared with their natural counterpart sucrose. Intense sweeteners allow for small portions to yield sugar-like sweetness in food products, thus enabling the manufacturers to label them as virtually sugar-free or non-caloric, adding to the glamour of the product. And the fundamental principle behind this upsurge in the use of artificial sweeteners is that individuals who are struggling with obesity can enjoy foods and beverages without the risk of additionally adding calories to their diet, and thereby controlling their normal calorie intake in day-to-day practice. So now we have sugar-free cola, we have sugar-free chocolates, we have sugar-free food products, and thereby uh, adding to the interest and attraction of the patients who are health conscious. Now, interestingly, global market of artificial sweeteners in 2010 was $9.2 billion, which has seen an increasing trend from there on, and in 2017 it was estimated to be having $10.25 billion and is expected to reach $13.85 billion in 2026, and there has been a consistent definite increase in the rate of sale of these products up to 3.4%. So every year some amount of dollars are spent over the purchase of these artificial sweeteners in every family. So we will be surrounded by artificial sweeteners everywhere, and it of course is tasty, adds to the taste, adds to the glamour, adds to the importance of being alert to our health issues. So many people boast of maintaining their calorie intake, and while maintaining their calorie intake, they increase the consumption of these non-nutritive sweeteners or the artificial sweeteners. So we may have in food industry as breakfast cereals, sugar-free or diet yogurts, snack bars, popcorns, beverages, milk, candies, gums, frozen desserts, fruit cocktail, and not only that, we also have drugs like sugar-free cough syrups, vitamins, mouthwashes, even toothpastes, lip glosses, lip balm, and everything. Now, the advantages of using artificial sweeteners is they can contribute pleasurable sweet sensations without increasing the energy intake. They do not increase the incidence of dental caries. They do not affect blood sugars. They decrease the calorie content of food. They can be used in non-food items to make them taste more pleasurable, can be used to replace sugar in cooking or baking. Only small amount is required to sweeten food and beverages and therefore may aid in weight control. Well, the disadvantages are they cause an aftertaste. You can have a bitter taste at the end of the food. They are not all good substitutes for sugar in cooking and baking. Limited history of some means not only is known beyond the accepted daily intake, there is limited research on the safety during pregnancy and sick patients. Warning label is required on foods that contain aspartame. Sweeteners or any sweet taste may increase appetite, thereby increasing obesity. They may alter metabolism, which can lead to overeating. Disadvantages can be also because of gastrointestinal tract, brain damages, the issue of cancer is there, and obesity, and we'll be coming to each and one of them. Amongst the gastrointestinal tract, we have known by various evidences that use of non-nutritive sweeteners or the artificial sweeteners can kill the beneficial microflora in the gut. They suppress the P-glycoprotein and the cytochrome P. They suppress appetite at times. They disrupt gastric acid secretion and disrupt the proteolytic activity. They have negative effects on the CNS. They have negative effects on the mentation, and long-term and overuse can cause mental dysfunction, lack of concentration, and some of the non-nutritive sweeteners have phenylalanine, and in patients who have genetic disorders of phenylketonuria, these phenylalanine products can lead to havoc. Some of the agents have been found in animal models to be highly carcinogenic, especially leukemia, lymphomas, and bladder cancers have been seen in animal models using these artificial sweeteners, and we need to have more studies to either blame these agents as carcinogenic or just free them of any conviction as far as carcinogenic potential is concerned. They can cause obesity. Now, as far as obesity is concerned, there have been, contradictory researches. Some of the researchers showing that they can cause obesity. Some of the researchers say that they can decrease the food intake and thereby control obesity. So we need more research to have a final say or whether these agents can cause obesity or not. And of course, they can disrupt the innate behavior. So let us come on to some of the important artificial sweeteners one by one, but to compare them, we have saccharin, we have aspartame, we have A-sulfam potassium, sucralose, and stevia. And here you can very well see the relative sweetness to sugar. And now A-sulfam potassium has 200, aspartame is 200 times more sweet than sugar. But when you see the stevia, it's almost 200 to 300, and sucralose 600 times more sweet than the regular sugar. Only aspartame has some amount of energy, that is 4 kilocalorie of energy per gram, while others are free of energy. The accepted daily intake of various products are very essential to know. Saccharin has the acceptable daily intake of 5 milligram per kg of the body weight. Aspartame 50 milligram per kg of body weight, A-sulfam 15 milligram per kg of body weight, sucralose 5, and stevia 12 milligram per kg of body weight. So acceptable daily limits need to be understood, reminded every time that you allow your patient to use these non-nutritive sweeteners, because once you start taking these agents beyond a certain daily intake, these start doing damages to your body. Most of the products are used as tabletop sweeteners. Only sucralose is stable at high temperature, and saccharin is can be used in baked foods. Others are used just as a tabletop. You cannot cook them, or high temperature, denatures them. So let us come on to some of the artificial sweeteners, and I'll be as short as sweet as these artificial sweeteners are. Saccharin, uh, which was discovered by Remsen and Feilberg at Johns Hopkins University in 1879, is the oldest artificial sweetener and has been marketed for more than 100 years. It is commonly used in soft drinks, baked goods, jams, canned foods, etc. And it is the most common household product, and you can find it in toothpaste, lip gloss, mouthwash, vitamins, and pharmaceutical industries. An important characteristic of saccharin is that its sweetening power is not reduced when heating, which I was just telling it, and hence it is an excellent candidate as an additive in low-calorie sugar-free products and can be used in baking as well. The advantages is it's not metabolized in GI tract and therefore does not affect the blood insulin level, which makes saccharin a viable sugar substitute for patients with diabetes. Since its introduction in market 100 years ago, saccharin has been researched extensively to determine its carcinogenic potential. Clinical studies have not been found to be any association with cancer in humans, but certain animal models have shown carcinogenic potential of these agents. The adequate dietary intake, as already told, is 5 milligram per kg body weight for adults and children. Aspartame, which was again discovered by James Cackler accidentally, and it's a methyl ester of 2 amino acids, aspartic acid and phenylalanine, as I was already telling you. It is because it's made of an amino acid, it provides a calorie of almost 4 kilocalorie per gram of aspartame taken. It's 200 times sweeter than sucrose. The acceptable daily intake for aspartame is 50 milligram per kg body weight for both adults and children. Aspartame is used as a sweetener in many products, including chewing gums, diet soda, dry drink mixtures, yogurt, pudding, and instant tea and coffee. As far as studies are concerned, it has in a study on the effects of artificial sweeteners on food intake, aspartame was found by participants to have more pleasant taste compared with stevia or sucrose. Furthermore, aspartame does not elicit the same response as sugar does in the brain or pancreas. Therefore, it does not stimulate an insulin response as sugar does. But there are certain side effects like dizziness, headache, GI issues, and mood changes with aspartame. Phenylketonuria patients cannot use aspartame because it has phenylalanine as its component. There have been some claims like causation of Alzheimer's disease, attention deficit disorders, birth defects, cancer, diabetes, Gulf War syndrome, and lupus with aspartame. S-sulfam K was developed by a pharmaceutical company, Haste, in 1967, is 200 times sweeter than table sugar sucrose. Initially, S-sulfam potassium was permitted to be used only in foods such as sugar-free baked goods, chewing gums, and gelatin desserts. Later, it was approved to be used in soft drinks by the FDA. The acceptable daily intake is 15 milligram per kg body weight of this, and it's a blended product comprising of an organic acid and potassium. Typically is found in food products in combination with other artificial sweeteners, which helps in developing an optimum flavor profile. Normally, it is combined with aspartame and sucralose to provide a synergistic sweetening effect. Sorry. Concern about its genotoxicity has been there, but then no evidence, strong evidence has emerged to demonstrate a genotoxic effect of S-sulfam potassium till now. Sucralose is one of the newer artificial sweeteners discovered well back in 1976, but approved by FDA recently in 1998 in 15 food and beverage categories. It has a taste profile very similar to sugar and has no unpleasant aftertaste and undesirable trait found mostly in other artificial sweeteners. Extensive testing has established an excellent safety profile for sucralose, allowing it to be used among all population groups, including pregnant and nursing mothers, which is very exclusive with this. It's 600 times sweeter than table sugar. Sucralose is most similar to table sugar, but unlike sugar, does not promote tooth decay. Sorry. Sucralose has found to be reported to be non-carcinogenic and non-genotoxic and has been deemed safe for consumption by patients with diabetes because it has no effect on carbohydrate metabolism. There have been some episodes of sucralose to be a causative agent in triggering migraine headaches, so beware of migraine when you are using sucralose. Based on the safety profile, a very excellent safety profile of sucralose, it has been also recommended to be used in children as well. Now, the latest artificial sweetener is Stevia, which is a natural artificial sweetener derived from a plant Stevia rabandina. And recently, Stevia has been marketed as a non-caloric sweetener in baked food and soft drinks also. Studies have indicated possible role of stevia in increasing insulin sensitivity and glucose tolerance in humans. As far as safety issues are concerning stevia, there has been no negative side effects as till now. Studies have shown that consumption of stevia significantly lowered insulin levels compared to both aspartame and sucrose, therefore suggesting that using stevia in place of sucrose might be an effective way of managing food intake and satiation concerns. Stevia is 200 to 400 times sweeter than sucrose depending on the type of application and formulation. The acceptable daily intake is 4 milligram per kg body weight of stevia. Stevia is definitely accompanied by an aftertaste, which is one of its drawbacks. Blending stevia glycoside with sugar alcohol erythritol helps masking this aftertaste property. The WHO estimates stevia market could eventually replace 20 to 30% of all non-nutritive sweeteners, and hence stevia is the generation next of artificial sweeteners. It is the artificial sweetener of the 21st century. It is widely used in soft drinks, Japanese-style vegetable products, tabletop sweeteners, fruit products also, and seafoods. So to conclude, we have seen all the different types of artificial sweeteners. Now, to conclude, the clinical and epidemiological data available at present are insufficient to make firm conclusions regarding the benefits of non-nutritive sweeteners displacing calorie sweeteners in energy balance maintenance or decrease of body weight or cardiometabolic risk factors. As a result, scarce epidemiological and clinical data on the pros and cons of consuming NNS, very few recommendations regarding consumptions of artificial sweeteners are made available. For optimal health, it is recommended that only minimal amount of both sugar and artificial sweeteners to be consumed. Today, there is a renewed emphasis on eating fresh, local, and natural foods to maintain good health and promote sustainability. This calls for a balanced diet that includes whole grains, vegetables, fruits, legumes, nuts, and seeds, low-fat dairy and lean meats, and avoidance or minimizing inclusion of processed food and additives that includes artificial sweeteners. So if these general principles of lifestyle are allowed, artificial sweeteners like sugars they replace will have an insignificant role in our diet and in our lives. Thank you very much. Thank you. So with that, I end my talk, and thank you again for the entire team of organizers of API Malwa for inviting me in this conference. Thank you very much.